sharing information about who we are, what we do. Obviously, you'll learn a lot more in the next hour. But yeah, so that's what those brochures are. And then our business cards if you want information on that. But thank you for being here on this beautiful evening. I'm so grateful that you guys spent your time to come here when it's like this outside. At least there are windows, right? My name is Dr. Ruther, and I am a physical therapist, and I own Ruther Health and Wellness in Holland, so downtown Holland. I am going to follow my notes because I go off on tangents a lot, so get used to your focus. But I specialize in both orthopedics, so anything from like hip pain, knee pain, foot pain, jaw pain, to as well as pelvic floor. And so we're going to be talking about back pain, of course, but also the interconnections with pelvic floor and back pain, because they're very, very interconnected in that way. A little about me, I have been a physical therapist for 9 years, and I helped thousands of patients. It's my passion. I'm kind of obsessed with my job. Get back pain relief and just pain relief in general through a whole body comprehensive approach. Because I believe it's so important not to have blinders on and just say, okay, you have back pain, let's just look at your back. Because we work as a unit and as a whole foundation. I want to start today by sharing a little bit of a story about one of my patients, because my patients are why I do what I do. I have a patient, she's in her mid-40s, and she came in to see me as kind of a last-ditch effort. She had been having pain for years. It had been progressively getting worse. She was actually a personal trainer, and she had tried everything, like chiropractic. She did physical therapy before. She did dry needling. She did injections. She consulted with an orthopedic surgeon. Like, she literally did everything. And the last person she saw was the orthopedic surgeon, and he said, "You're gonna have pain for the rest of your life. You're gonna have to find a new job." And she loved personal training. I mean, I feel like a lot of personal trainers, that's like their passion. And so she came to me because her massage therapist or somebody was like, "You need to see this girl. She does things different." And that's not to pat myself on the back, but she, at this point, she couldn't even walk to her mailbox and back without the rest of the day having to pay for the pain in her back. She'd have to be in bed just from walking to her mailbox and back. This is coming from the girl who used to do like 50 burpees, right? And then all of a sudden her body decided, not anymore. And during her first visit, what I did is I tested her whole body, like I always do. Tested her pelvis, tested her rib cage position, and I found that her pelvic position and her rib cage position were not in proper alignment. So they were kind of misaligned. And we'll go into this, I love my models, in a little bit here. But what that was doing is when her ribs, I'm going to exaggerate, but when her ribs were flared and her pelvis was tipped, it was causing a lot of compression in her lower back. So kind of in this lower lumbar area, and it was causing sacroiliac joint pain. So that's this joint right here that's moving. That's where your sacrum meets your iliac. So it was causing compression here and compression here. And so what we did is I sat down, explained all of that to her, and we did 2 exercises to help improve her position, which we're going to go through some of those today too. And after she did those, she sat back down and she just started crying. She's like, "I have hope for the first time in over 10 years. Because every single doctor has told me, just get used to not doing what you do." And that is why I do it. And that's why I'm so passionate about doing what I do. And that's also why I do these events. Is because I want people to know that there is hope, that you don't have to live in fear of your back going out, or you don't have to let energy be sucked out of you, because pain is exhausting. And it's really annoying when you can't do what you love because pain is holding you back. You're like, I want it to be my physical ability, not my pain that holds me back. So I like to preface it with that, to just be like, there is hope. Even if you got a diagnosis of you have arthritis, which she did, there is still hope. You can still get back to doing what you love. And so just last week, actually, she sent me a video of herself doing 20 burpees in a row, doing double unders with 0 pain. And it's so cool to see. I literally have the best job in the world, I think. But so that I just wanted to preface that if you've been told you have arthritis, or if you've been told this is what it is, that isn't necessarily the case. And I hope you feel that way at the end of this. which men have pelvic floors too. And a lot of people are like, oh, that's just a female thing. It's not at all. We're going to go over simple tests to help you understand your specific situation and kind of where your body's at currently. And then daily strategies to help you reduce some of your pain. So, also, if you guys have questions, shout it out. I like this to be a conversation. I'm used to working with people, so don't be afraid to interrupt me, raise your hand, whatever. So I want to start with a poll, just so I understand like why you guys are here, what brings you here, where you're currently at. So I want you to raise your hand if you have struggled with back pain in the last year. Okay? I want you to raise your hand if you struggle with back pain daily. Okay? And I want you to raise your hand if you feel like your back limits you during your workouts. Okay? And last one, I want you to raise your hand if you're here to just learn as much as you can about the human body. I love it. That's like my person. Okay, so first, before we get into it, what we need to understand is the anatomy. Because everything, if you can understand the anatomy, you can understand how to fix your pain. Okay, or I can help you understand how to fix your pain. So, first and foremost, your spine sits on your pelvis. Okay? Seems very basic, but the pelvis is everything. The pelvis is the base of the spine. So where the pelvis goes, the spine follows. Okay, there are so many more strong muscles that are attached to the pelvis that can grab on and move it compared to the spine. That's kind of, they have a lot of muscles, but a lot of small muscles. These are like your butt muscle, your glute max, it's powerful. And that can just grab on and move it. So your spine is going to follow your pelvis. Also, if your pelvis is kind of tipped forward, so I see this a lot in patients, is it's tipped and flared. That's going to cause both, like I was just explaining with my patient, the compression in this low back, and it's also going to cause compression in these sacroiliac joints. So your SIJ, or sacroiliac joints, are where your sacrum meets your ilium. So these right there. So if your pelvis is out, that can cause a lot of irritation and compression there. Also, your pelvic position, if this is off, it can create imbalances in the surrounding muscles. So like your abs, your hamstrings, your glutes, your inner thighs, your adductors, that's what those are called, and so many more muscles. So having that proper positioning helps the muscles function more optimally. Does that make sense so far? Any questions so far? Okay. So in regards to back pain specifically, I want to talk about all the different categories that can contribute to back pain. So first of all, there are structural issues. So this is like a herniated disc or a disc bulge. Have you guys ever heard of those terms before? Arthritis. This is going to be like spinal stenosis. So that's like narrowing of the spinal canal. Those things can be helped, just like with my patient. She was diagnosed with arthritis. But those are just kind of a contributing factor to back pain. There's going to be postural problems, okay? And this is so much more than just like how you sit, stand, and move. This is going to be also your natural innate posture. Is how does your brain put you in alignment when you're doing your daily activities? This isn't just like sit up, chest up, chin up, right? This is actually horrible posture. Interesting, this is going to cause a lot of compression in your back. But it's about so much of your body's natural positional posture. Muscular imbalances, like I kind of touched on. And we're going to go into this really in depth today, is because there's so much misunderstanding in regards to a muscle is like tight or a muscle is weak, right? It's like either stretch or strengthen, but it's so much more, the physiology of this is so much more in depth than that. And then also movement patterns, right? How we bend, twist, lift. And some of that is us choosing that, right? Like fix your squat form, things like that. And some of that is just how our body naturally is kind of fighting itself. And then systemic factors. So things that are going to influence your nervous system, and that's very connected with your pelvic floor. So that's like stress, sleep, nutrition, overall health, things that increase inflammation. So as you can see, there are so many things that go into a diagnosis. So if you get like a diagnosis of arthritis, it's so important to dig in and say, okay, but why? Why am I experiencing this pain, or what is causing it? Not just accepting it as a fate. And actually with MRI findings, we put so much trust in images. Who here has ever gotten an image before? And did it show anything abnormal? Yes, okay. So, images are not bad, okay, at all. It gives us information, but it's not the whole picture. So you can actually have two people with the exact same findings on their image, and they will have completely different symptoms. And research shows this in depth, but I also see it in my patients all the time. Is I will have a patient who they're like, yeah, I got x-rays of both hips, and the doctor said my right one is horrible, but I don't have any pain there. Like, it's actually my left one that hurts, but they said that one looks good. So just because you have an image that says something doesn't mean that that is what's causing your pain. Does that make sense? Okay. So yeah, just a lot of people have a hard time, my patients do, getting, you know, if they see this on the image, that must be it. You know, we like a diagnosis, we like an answer, understandably. But it's important to keep your mind open as to like, okay, but what is actually causing my pain? And it could be that, but more often than not, it's not. Okay, so a key insight so far, and we're gonna get into the moving part, I promise. Back pain is rarely just about the back. We gotta take those blinders off and look at the whole picture. It's about how the entire body functions as a system, particularly your pelvis, your core, your abs, and then the surrounding muscles around the pelvis and the core, around the back and the core. Okay, we're gonna do another question. So, how many of you have tried stretching your back or getting massages for relief? Okay. Now, how many of you has that completely fixed your problem long term? Okay. Right, nobody, which is a typical answer. That doesn't mean it's bad. Massages feel great. I get massages too. But the reason for that is that back tension is the symptom, it's not the problem. Okay? So when your back hurts, it's usually your body's alarm system to say, hey, something's out of balance. I'm gonna grab on here and tell you something's wrong, and it's our job to figure out what is it that's out of balance causing this alarm system to go off. Okay, I want everyone to stand up. We're gonna do a test. Okay, I want everyone's feet together, legs straight. This is a very simple test, and I want you to go to touch your toes. What I want you to pay attention to is where do you feel tightness? Is it in your back? Is it in your hamstrings? Is it in your calves? I want you to pay attention to how far you can go down. Good. Okay, come on up. Good. Okay, you can sit down again. We're gonna do that test 2 more times today. So, first, who here, tell me one thing that we're testing with that.
Do what?
What is one thing we're testing with that test? Like, what is one thing we're looking out for?
Flexibility.
In what?
Release.
Yeah, good, very good. So, yes, and that's like a very standard, absolutely. But I want to go into why the hamstrings are not testing optimally. So who here could touch your toes? Okay, who here could go further than touching your toes? Okay, so a lot of the time we think, sweet, you can go further, gold star, right? It's actually not the case. I know I'm bursting your bubble right now, but I'm sorry. So a muscle belly, so like a whole muscle, is made up of a bunch of different muscle fibers, okay? So a ton of muscle fibers make up this muscle. And ideally, our muscle fibers will overlap like this, okay? So when a muscle contracts, those muscle fibers grab onto each other and contract to pull closer together. But if your muscle is too long, let's say if you can like palm the floor, you can't grab on to those muscle fibers properly, and so then your muscle contraction will be inefficient or act weaker than what it should be. So then the hamstrings can't work well. The hamstrings can't work well. Something else along our backside needs to pick up the slack, which often ends up being our back, right? Because if we didn't have any muscles, we would just fall forward. So something, our calves, our back, need to pick up that slack. And similar, if your muscle is too short, it also doesn't perform very well because you can't really contract an already contracted muscle, efficiently at least. And so it's really important. We want to be able to touch your toes, but I actually don't want you to go further, and I don't want you to be a lot less. Okay, so there's kind of a happy medium. Does that make sense? This is going to be, has anyone ever heard this before? In regards to like this, you have heard it, perfect. So in addition to that, so now we know you don't want something that's too long. You also don't want something that's too short. But it's also about the pelvis, right? Everything is about the pelvis. Does anyone here follow me on Instagram? Or have you seen my Instagram? Okay, perfect. So a funny story. I guess I don't say funny, but when I was working, I had specifically women come in often and just tell me these stories of how they're like, oh, I thought that was normal, right? Specifically with the pelvic floor. They're like, well, my doctor told me that leaking after you have kids is just what happens. Or my doctor told me that painful intercourse, just have a glass of wine before. Like answers like that just made me like cringe, right? And so I started posting information on Instagram to be like, how else can I tell more people, again, that there is hope, that you don't have to live like this? Because they're not getting it, nothing against doctors at all, but they weren't getting it from their doctors. Their doctors see 25 patients a day. They don't really have time to get in the weeds there. And so I was posting for like a year, just to, again, help people in the community to educate them. And I, at that point, had like 1,600 followers. I was not planning on telling the story. And one day I was in church, and I just started praying. I was like, God, show me how I can help more women. And I treat men too, but I primarily see women. And within 2 days, a reel I posted 3 months before went from viral, and I went from 1,600 followers to 60,000 in 4 weeks after posting for 2 years. Like, it was, like, I still get chills thinking about it. But, so now that's why I post this, because I'm like, okay, God, well, I don't know an answer now. Like, I mean, I guess I have to do this. But, so I share information on Instagram, so I was asking that. But, anyways, back on, I told you about my tangents here. Back on topic. So, if your hamstring attaches to these butt bones here, okay? So if your hamstring attaches there, and then it goes down to your knees, if your pelvis tips forward, that band gets pulled tight, right? So if you think, if I have this band like this, and I pull this tighter, and then you're like, oh, the band is pulled tight. Like, you're like, yeah, no duh. Would you stretch it more to try to loosen it? Or would you bring the 2 points together to loosen it, right? So kind of the same thing goes with the hamstring, is if your pelvis is tipped, or you're like this a little bit, I'm exaggerating, but if your pelvis is like this, you're pulling that band tighter. And so then your body will act like the muscle's tighter than it actually is. Therefore, pulling tight, therefore, working inefficiently. Does that make sense? Even if you can pull on the floor, you still honestly, you're probably more likely to have a impaired position, because those hamstrings aren't working efficiently to pull you back. Because those are going to be the biggest thing that pull you back into this alignment. So it's about the pelvic position, it's about the limb-tension relationship, all to improve this, to reduce compression here. Make sense? Okay. Has anyone heard that before? Nice, you're on it.
Watch your stuff.
Oh, you see it on my That's awesome. Okay, good. So now we're going to actually put that into action. Okay. So what I want everyone to do: stand up again. We're going to touch your toes again. But I want you to really solidify in your brain, one, what it feels like, right? Where is the tightness? And two, exactly how far you are down your thighs. Because we're going to do an exercise and we're going to retest. Okay? So everyone go ahead and go feet together, legs straight, just so we can control all the variables. Yep. Keep your legs straight, and I want you to really touch your shins and see how far down you are with your arms straight. Yep. Okay, and see, do you feel it in the back? Do you feel tightness in the hamstrings, tightness in the calves? Okay, good. Come on up. So now we're going to do an exercise. Okay, are you guys ready for moving around? And then we're going to retest it. Okay, we're going to kind of put it into practice. So first, are you guys okay going on the floor? Okay. If you're not okay going on your hands and knees, tell me and I'll give you a different thing to do. But go on your hands and knees if you're able. Okay, if you cannot go on your hands and knees, put your arms like this on the table. That's totally fine. patients, I can't all the time. Good. Okay, what you're gonna do is keeping your hands and knees on the floor, I want you to push your chest away from the floor like you're doing the cat position. Yeah, is this painful here?
No.
That's okay. Put your hands like this.
Okay.
And then push and tuck. There you go. Good, can you feel that in your abs a little bit?
A little bit.
And a little stretch in your back?
Yes.
Okay, good. Good. So yeah, you're gonna kind of, I'm gonna kind of come around here. You're gonna kind of pull up, and I want you to take some deep breaths. Take about 5 deep breaths here. Yep, just like that. Kind of feel that pull through here. Good. Keep breathing. Just kind of pulling. Very good. There we go. Good job. Yep. Some deep breaths. Do about 2 sets of 5 breaths. Good. In through the nose and out through the mouth. Very good. So I feel okay. Good job. Very good. When you're done with about 2 sets of 5 breaths, go ahead and relax. Okay. Now what I'm gonna have you do, I will give you another one, right? I'm gonna have you go on your back with your feet on your chair. And I bet you didn't think you were actually getting on the floor today. your hips need to be about 90 degrees. Good. Just put your arms like
What's
this on the
that?
table. Yep.
That one might not. Yeah, or else we could even.
Yes.
There you go.
Yeah, good. So you want your hips and knees at about 90 degrees. Yep, good. Yep. And then what you're gonna do is I want you to put your right fist in between your knees. Yep. Can you relax your head on the floor? Good. Okay. Squeeze your fist with your knees and dig your heels down to feel your hamstrings, the back of your thighs engage. Good. Can you guys feel your hamstrings working?
Flexes are like really jacked up.
Why do you feel
Okay, go.
Yep, squeeze
I'm
this.
gonna take like 2 or just one. Okay.
And then dig your
Yeah,
heels.
that's better. Yeah.
Yeah, so if you feel your hip flexors or the front of your hips, widen your feet a little bit on the chair. And still so kind of separate your feet a little bit more. Yeah, there you go. And then still put your fist there. Good. Yep. Can you relax it down? I know. Normally I put a ball between your knees. I don't actually normally have your fist here. So at home you can like throw a toilet paper roll between your knees or a ball or something. Good. Take about 10 deep breaths. So what we're doing here is the first one, we were getting your abs, some of your deep abdominals, like your transverse abdominis, to help pull your pelvis back from the top down. This one, what we're doing is we're getting your hamstrings and your thighs to pull your pelvis back from the bottom up. We're doing about 10 breaths. Go ahead and stand on up. Oh. So then when you help getting up, we can absolutely watch peek and all. Good job. I won't make you get on the floor again. I promise. Okay. So now what you're gonna do is we're gonna retest. So feet together, legs straight, and we're gonna go to touch your toes again, see how far you go and see how it feels. Okay. Good. Come on back up. So raise your hand if you're testing either felt less tight or got further.
Oh.
Good. Very good. Yes. So, and if it didn't, so yours did not, well, you were already excessive.
Yes.
Okay. so when you're already excessive, you actually need more stability than someone who isn't. I'm also hypermobile because I was a gymnast, and so my joints are super loose because I stretch them that way. So we just need a little more stability than other people. But okay, you can sit down. Good. So we did not stretch our hamstrings, right? We activated them, and they got looser. Right? So it's not. Actually, I never tell my patients to stretch their hamstrings. I usually tell people, like, if you are excessive, stop stretching your hamstrings. Because what we want is we need those hamstrings to be able to create that hold effectively. We need that passive tension to be able to hold this pelvis upright so that your body doesn't constantly fall forward and make you overwork that back and compress the spine. Does that make sense? Any questions about that so far?
Would you mind just touching on, I know like even in that situation, like obviously like the flexors play a big
Yes.
role. I'm sure you're probably gonna maybe touch on that a little bit, but just would love your take on
Yes.
that side of things. Too, would
Absolutely.
be
So
awesome.
I would not be surprised if both sides of your pelvis are pretty significantly forward. So your hip flexors, also known as the primary hip flexors, called your psoas, just FYI, that attaches all along your lumbar spine, so your low back, goes forward and attaches to your femur. So that's going to be one of the most powerful muscles that holds you forward. Okay? So one of the best ways to inhibit that or kind of down-regulate or shut it down is by working the muscle that pulls your pelvis back, which is your hamstrings, right? So some people, their patterns will be so strong, or their compensation patterns will be so strong, that when they try to activate their hamstrings, their brain's like, I don't use those, I use these, right? And then it will be like, I know how to use these, I don't know what the heck you're talking about with the hamstrings. And so it will try to activate that. Does that make sense? So it's all a compensation pattern, and what we need to do is really dig into kind of down-regulating those. So your hip flexors are going to do external rotation and flexion. So what I had you do is I had you do more internal rotation.
Yeah, to kick those up.
Yes, to kind of shut them down. So doing more of the opposite move to inhibit.
Totally.
Does that make sense? But yeah, a lot of it is, especially people who are hypermobile, who have more mobility, your body is really, really good at compensating. And so we need to really finesse moves to make sure you're using the right muscles. Because you could do that exercise and get nothing from it because you're not using the right things. It's just as much about where are you feeling it than it is about how does it look. So with my patients, I'm always like, okay, where are you feeling it? It's probably because they're like, Kelly, like, I get it. I'm like, no, but exactly where? Tell me where, because then I know if your body's doing it properly, or if it just looks good and you're not choosing the right muscles. Good question. Yeah.
I do have one question.
Yeah.
You talked about the hamstrings and the calves. Are the calves gonna be similar to the hamstring issue? Or is it something
The
different?
calves are going to be similar to the back. So the hamstring, the calves and the back are going to compensate for weakness or inability in the hamstrings. So oftentimes I find people with like hamstrings that are kind of on vacation, and their calves or their feet, because the fascia from your calves. Do you guys know what fascia is? It's like the saran wrap that holds us together. But it connects different muscles together. So the fascia that envelops the calf also envelops the plantar fascia on the bottom of the foot. So if your hamstrings are on vacation, your calves overwork, causing foot tension, also causing back tension. Does that make sense?
Yep.
Yeah. Good question. Very good question. Any other questions?
So are you saying
Yeah.
your calves that are tight?
Yes.
Yeah.
Yes. They're overactive. They're picking up the slack.
So would that be a lot of fasciitis?
Yes.
Well, maybe it's the what I have, Lord help. Foot pain one that feel really bad.
Your
Yeah.
foot pain.
I don't know what's going on with foot pain.
When you do leg day, I don't know what you guys bring
Yeah,
up.
pretty sure like a little.
Where are you sore?
It's my here in my, they say I have bursitis in my heels. This is what the doctor say. But it's really painful at the edge of my heel.
So then again, it goes back to, okay, cool, I have this diagnosis, but why?
Yeah,
Right?
why?
You're like, I don't really care if what it's called.
Yeah.
I just care if it's
I need to know
called.
what happened, and for 10 months I don't have relief.
Yeah. When you do squats, afterwards are you more sore in your quads or your hamstrings or your butt? Hard question, I know.
Yeah.
We just have you start doing squats.
No, not saying that.
I don't know because
No, that's okay.
It's
I-
really
I
bad
would-
when I fit.
I would guess you're probably more sore in your quads because you're probably not using your hamstring and your glutes properly. So you're overworking your
I was
quads.
thinking, well, now when you say that, I was thinking I have to have something really more deep, like over here or here, because they don't have, I can't find anything, any other
Yeah.
answer. They got right, whatever they say, nothing, I don't have nothing, just, I don't have whatever. you
Plantar
say.
fasciitis.
So,
Yeah.
what I have, what's going on?
Yeah.
Now I feel like I have the answer.
That's
Yeah.
a piece of it for sure.
Yes, absolutely, a piece of it, for sure. Good question. Any other questions so far? Yeah.
Now, when we're doing like the glute bridges, the coaches are always going, do you feel that in your hamstring? What's,
Do you?
oh, sometimes I do, yeah.
Okay,
It's
do you
not my
feel,
hamstring, it's my glute,
do you feel more your quads or your hamstrings?
my hamstring.
Okay, that's good. What was your question? Sorry, I interrupted.
So it's, when they say, do you feel it in your hamstrings, that's where we really want to feel when we're doing the glute bridges.
Yep. And a big thing with glute bridges, this is what, in my opinion, I don't. So what a lot of people will do is they will go up to the highest point. Here, I'm using my back. I'm tipping my pelvis forward. And so what you want to do more is here. It's kind of like you're tucking your tailbone. So you're lower, but you actually will get a lot more glute and hamstring activation. Compared to here, you're going to get more back activation. So that would be one cue I would give people is I say, when they're on their back, I'll be like, okay, let's tuck. They'll be like, oh my gosh, I feel so much different. For push-ups, what a lot of people do is they kind of are extended. If you actually get in the right position and kind of like bring your ribs down, they're so much harder. Because you're using the right muscles instead of just kind of hanging on some of those muscles that are used to doing all the work, but we don't want to do all the work. Yeah, does that answer your question?
Yeah.
Good question. Any other questions? I like the questions. Okay, good. So, where was I? Okay, so summary so far. Your pelvic and your rib position, and I'll talk about the ribs in a second here, matter tremendously, right? You want and need optimal muscle length tension relationship for efficient function. So if a muscle is acting weak, always ask why. Or if a muscle is constantly getting tight, like you feel like you have to stretch the same muscle before every workout, there's a reason for it. Your body doesn't do anything for no reason. And then always, again, ask why to find the root cause. Don't just accept an answer or a diagnosis as the symptom is not the answer. Does that make sense?
Yeah.
It's a piece, small piece. I care so much more about, I always laugh when I get referrals and it's like, it sounds like a very scary, fancy term, and I'm like, this is not helping anybody. Then people get this in their head, they're like, this sounds very scary. And like Achilles tendonitis, and that's like it's like, okay, your calf is overworking, causing the tendon, which attaches the muscle to the bone, to get inflamed, and then it's pissed off. That's what's causing the pain, right? And then you have to ask, okay, now why is the calf overworking? So it's always digging another step further, another step further, another step further. Okay, so now I want to talk about the pelvic floor and that connection with the back. Who here knows what the pelvic floor is? Okay, good. It is this thing that is you hear the word, right? And then you're like, I don't know what it does. It is exactly what it sounds like. It is muscles on the floor of the pelvis. So this shows half of the pelvic floor. Okay? So these are the ligaments, which if you have loose ligaments, if you're hypermobile, I would be curious, and keep pointing at you just because I know you have more mobility. If your ligaments are a little looser, something else has to pick up the slack. And so a lot of the time, people who are more mobile actually have pelvic floor dysfunction more often than those who are not. It doesn't mean that you can't have pelvic floor dysfunction if you're also fit and can't touch your toes, but so anyways, tangents, I'm so bad. I write notes and I still laugh. So your pelvic floor are the muscles of the floor of the pelvis. A lot of people, again, men have pelvic floors too. They're also very important for men. We tend to talk about it more for women because of childbirth, right? Our pelvic floors go through a lot of trauma with childbirth, but men also have pelvic floor dysfunction, and we also need a lot of stability with the pelvic floor for normal life. So it plays a massive role in pelvic and back stability, of course, bladder control, sexual function, pressure regulation is going to be really important. balance, power generation. So when I have people, some of my patients are like, when I try to do a box jump, it's just like, I feel like it's dead weight. And when we get their pelvic floor to create more, because again, it's the whole floor of the pelvis, it can make your glutes work more efficiently and really can get you just that extra oomph. Does that make sense? And so much more. So how the pelvic floor creates more power is if you think of here as a Coke can, okay? So the top of the Coke can is our diaphragm. Our diaphragm is actually a massive muscle. We don't really think of it as a muscle, but it is. The bottom is our pelvic floor, which again is a big group of muscles. And around is our deep abdominals, our transverse abdominis, and some of our small stabilizing back muscles. So ideally, if you had a Coke can that was full and wasn't open, you could stack books on it, or you could even stand on it, and it wouldn't crush, right? Because you have that internal pressure pushing out equally in every single way. But if you were to open the Coke can, and you would try the same thing, it would just crush, okay? Because we don't have the internal pressure regulation. So if one part of that Coke can, or the diaphragm, pelvic floor, and abdominals, is dysfunctional, it can cause dysfunction in all of them. And then you don't have that proper power regulation and that proper pressure regulation anymore. So that's why a lot of women have leaking with like jumping, sneezing, coughing, because that's increasing downward pressure, and their body doesn't know how to regulate it. Does that make sense? And so that's how it is really interconnected with that pressure regulation, with internal pressure pushing out, that creates a lot of stability for the spine in the pelvis. And then also, of course, if we have stability, we have better balance. So as we've discussed, that muscle link tension relationship is very important, right? So if you think, if I was like that, see what that would do to the pelvic floor, right? That's significantly going to impact, this is a lot of different parts, this is significantly going to impact the length of these muscles, right? Can you guys see this over here? Okay. And so if your pelvis is like this, what that's going to do is ideally we want a pelvic floor that's a trampoline, okay? If you jump on a trampoline, you spring back up, right? That's what we want from our pelvic floor. But if our pelvis is like this, you do it with one hand, we have a hammocked pelvic floor. And if you try to jump on a hammock, that's not gonna work very well. So either your pelvic floor things will go through, like leaking, or what can happen often is you don't have leaking, but you have an overactive pelvic floor. One that is just holding on for dear life because it's not working efficiently. Kind of like the hamstrings. So if you have hamstrings that are too long, they can still feel tight because they're just like, if I let go, she's gonna fall apart, or he's gonna fall apart. So, I'm forgetting where I was going with that. We want a proper pelvic position to have a trampolined pelvic floor, to have better pressure regulation and better power. Does that make sense? Does that make sense how it connects to the back? Because that internal pressure stability. Okay. So some symptoms of pelvic floor dysfunction, some of them are like, oh yeah, I know that. Some of them are like, oh, what? Frequent urination. So if you have to urinate more than once every 2 to 3 hours. Urinary urgency. So if you have to go to the bathroom, you're like, I gotta go now, otherwise it's gonna be bad. Leaking with jumping, sneezing, coughing, constipation or straining, sensation of heaviness in the pelvic region, lower back pain that gets worse throughout the day, hip pain that tends to move around and doesn't kind of stick in the same place, foot pain, jaw tightness. Like I said, these ones you're like, what? Carrying your stress in your shoulders, and back pain that traditional treatments haven't resolved. So, I know it sounds kind of crazy, but those, especially the foot pain, jaw tension, carrying your stress in your shoulders, are actually more often due to an overactive pelvic floor than an underactive pelvic floor. Questions about that? Yeah.
The Kegels resolve the issue of an overactive pelvic.
You can tell he's my husband.
Yeah.
And that would make things worse. Significantly worse. So, who here has ever been told to do Kegels? Okay, yeah. I'm not a fan. They are right for the very right person, but they're definitely not the best. how much more pelvic floor activation you get from a glute bridge than a Kegel is like 5 times. So it's like, why sit there and do this awkward move that no one does right anyways when it doesn't work? And again, it's 90% of the time, it's not about a weak pelvic floor. It's about what position is the pelvic floor in. Is it a good link tension relationship? Is it doing all the work, are the muscles surrounding it slacking off, making it overwork? Right? It's always figuring out why is it acting weak. Does that make sense? Because you use it with every step you take. You use it when you stand up. So why would it be that much weaker than all the other muscles? And even after childbirth, this is one of my pet peeves. It's like, with the pelvic floor, you are pregnant, holding so much more weight your whole pregnancy. Then you give birth, and all of a sudden everyone's like, you need to strengthen your pelvic floor. You need to retrain it, because it went from here to here, but it's strong, right? It just doesn't know what the heck it's doing. It's traumatized. And so, yeah, again, Pete's leading me, he knows what's like my trigger points. Things that get me heated up, but yeah, Kegels are the easy answer, but not the best answer. Does that make sense?
Is there any particular tests you can do or anything like that to kind of pinpoint it a little bit more?
To see what the pelvic floor needs?
Yeah, correct, yeah.
So, yes, there are a few different ways. One is just seeing the position of the pelvis, is seeing the stability of the hips, seeing like the whole picture first. Then what you can do is you can do an external release of one of the muscles of the pelvic floor. I will do that sometimes to be like, okay, is this changing things? And then the best way, the most comprehensive way, is see a pelvic floor specialist, because they can do an internal assessment. And then they can actually physically assess every single muscle in the pelvic floor, because it is like a bowl.
Sure.
And so that is the most comprehensive way. You have to find someone that is specialized in it. We are, but there aren't. And unfortunately, in the PT world, anyone can call themselves a pelvic floor specialist. There aren't any regulations, which is not okay in my opinion. But because I'll have a lot of patients that come and be like, I tried pelvic floor physical therapy before and it didn't work. And I'll ask where they got it done, and they're like, and I know a lot of the pelvic floor specialists in the area, and I just know some of them aren't trained at all, but it's a popular market, and so a lot of people will say they are when they're not. Yeah, there aren't a lot of regulations around it, which is, it's always like advocating for yourself and knowing if you have someone that comes in and just says like, just do some deep breaths and do Kegels, probably walk out the door. Yeah.
What kind of timeline would you say, like, let's say that you've been dealing with this for a month. Should you go see someone after a month? Should you wait until it's been 3 months or what kind of timeline would you suggest?
I would go right away.
Okay.
The longer you have it, the longer it takes to fix,
Got it.
typically. Not
That makes
always,
sense.
but,
Yeah.
and personally, I wouldn't want to deal with leaking,
Yeah.
at all. If I had it for a week, I'd be like, okay, let's get this thing fixed, but I also know. So yeah, I would, the faster you get it resolved, the faster it gets resolved.
Okay.
Yeah, good question.
Awesome.
Most people don't even ask those questions or volunteer the information.
Yeah.
That's the challenge.
Yes, yes.
Absolutely.
Or they don't know the answers.
Yeah.
That's
Yeah.
what I'm assuming.
I literally been in an OB appointment for myself before, and they're asking me questions about how to treat pelvic pain patients. Which is, I'm like happy to answer, but it's very interesting. And again, not all, right? And they have so many patients, I'm not faulting them. It's not in their education. My OB was like, I feel like I should take a pelvic floor PT course. I'm like, you probably should. It's a great idea. So yeah, and that's again the reason why I like to do these, is to be like, because people don't know. Like, you don't know what you don't know. So yeah. Does that make sense?
Thank you. Yeah, totally. Thank you.
Again, I'm going off on so many tangents. I'm sorry. Any other questions before we? Okay. Okay. So now what I want to do is put it all together. So we are going to test a couple of you guys, if anyone's up for it. First, yeah. We're gonna test your pelvic position. So first of all, who here has back pain? like in this area? Okay. Who here is pain in that area on the left side? On the left side.
Both sides?
You want both sides? What are you guys do? You want both sides? Right side?
Right.
Or you could you touch your toes? You could
the first time.
but then you could the second time? I'm not surprised everybody's secretly checking. I don't want to fix it, not. Okay. Both sides, you had it on, you had it on right side, and you had it on right side. I kind of want two people with the same, you're hypermobile. I don't know if you're gonna respond right away, because usually hypermobile people are more tricky, but I will test you after too, but I want to test you guys if you're up for it.
Me?
Yeah. Sure. Can you say your names?
Julie.
Julie, Lori, okay. Because I want to have two different people with two different hamstring tests, because you're going to do different exercises. Okay, so, right SIJ pain, right SIJ pain. What aggravates your pain? What causes it to get worse?
Certain lifting,
Okay, like hamstring lunges.
lunges, deadlifts.
Okay, yeah, that's what I meant by hamstrings.
Yeah.
Words right now. Okay.
I'm pretty sedentary in my job, so some of that.
Okay. And what about you?
Yeah, I think
Same.
it's lunges.
Yeah. With which leg forward? The right leg forward?
Flats.
Okay, yep, okay. Do you care if I test you guys? Sure. Okay. So, what I'm gonna do is I'm gonna test their pelvic position. And then I'm gonna walk them through an exercise. And then we're gonna do a test. So, first, can you do a lunge and see how it feels?
Can I what?
Do a lunge. I want you to just like solidify in your brain how it feels.
Okay.
So right foot forward, yep. How are you feeling? Totally fine.
Just
I wanna fight.
Oh, good. Yeah.
I wanna find
You can do it
out.
right now. Okay, tightness. Okay, good. So go on your side.
Where's that?
I will test both. Okay, and bend your knees. Okay, I'm gonna take a second, swing it back so you relax as much as you can. Okay, and then let this leg drop down. Okay, so I am testing her left pelvic position. Her knee should fall to the table. It's not going there. You feel like there's no way, right? You go on the other side. You feel like I was just stuck. Yeah. Okay, bend your knees. I'm gonna take a second, swing it back. Good, and you relax. Okay, not going anywhere. So pretty similar on each side, would you say? Okay, go on your back. So this is just another way to test our hamstring. Straighten your legs for me. Okay, so we're about 90 degrees, which is good. That's where I want it. Does it feel tight?
Yeah.
Probably because we do the other exercise
Yeah.
first. Okay, good. So I'm gonna have you go on your left side. And have you bend your knees. And I'm gonna have your feet up against you. Good. Okay. Slide this knee forward, keeping your foot on me. Yeah, good. Okay. Keeping this foot on me, now lift this knee up. Hold it right there. What do you feel? I want you to feel it here, so keep holding.
Oh, I can feel it.
Feel there? Okay. Oh yeah, do you feel it right here?
Yeah, I feel
Okay,
it.
and then we're just gonna hang out here for a few seconds. So what we're doing, so we know both sides of her pelvis are tipped forward, okay? So that's gonna cause compression in those sacroiliac joints. For her, the right side is worse. We know her hamstrings are testing well, so what I'm doing is I'm giving her body back some of the stability that it's craving. So I'm working this right glute max to stabilize that right sacroiliac joint and pull it back in place, okay? You don't have to have all this memorized, don't worry. But we're gonna retest in a second here. Good, the burning. Okay. It's harder than it looks.
I know.
So with clamshells, this is not so the shift forward is very important here. It's not just a standard clamshell. Like, would you say this is harder than a standard clamshell?
Yeah.
Does that shift forward, if I should do more? Does that get harder?
Yeah.
Yeah. We're isolating this glute, making sure her back doesn't overwork. Okay, relax. See if it did what I wanted it to do. 10 seconds back. Go and relax. Relax. Good. Not 100% there, about 75. Do you guys see the difference? Can you feel the difference?
Yeah.
Go on the other side.
So are you saying we should do this on our own at home?
Depending on what your pelvic position is.
Flex or relax.
Very good. Okay, stand up and do a lunge here. Let's see how that feels.
Isometric stuff's always good for activation.
Good. Feel what? Wiggle? A little. Okay, so what did you say about your back?
I don't feel as much.
Okay, good. So yeah, you can sit down. Okay, not magic, right? Obviously. All that we are doing is we are teaching her body. So I would do that when I'm home, right? Teaching her body how to pull itself into the proper alignment while stabilizing it, right? I'm not just nothing against manipulations at all, but I'm not pushing her there because then her body doesn't learn how to keep it there, right? She's learning how to pull it there and hold it there to ultimately decompress that sacroiliac joint.
So she can do that on her own.
Yes.
Like, should she be doing it before she comes to boot camp?
Very good question. Yes. I would do it twice a day. And what time do you work out?
5, 10.
AM. For you. I'm a 5-month-old, so to be fair. But
You're up, but just not yet.
yeah, I'm up the time.
Yeah, you're up.
But yeah, I would do it before and after your workout and at night.
Okay.
Yes, very good question. Good job putting that together too. Because yeah, you want to optimize the position to optimize the efficient strength during the workouts. And then afterwards, you're probably going to fall back out of place during the workout because your body doesn't know this yet. And so then afterwards, you'll reset yourself so when you're sitting all day at your job, you're in the right alignment.
Okay.
Yeah. Hey. Does that make sense?
Yes.
Okay.
Thank you.
Any questions about that one?
I was just gonna say, I think I've seen a lot, and even in my experience of like, you know, how many people do clamshells with like a mini band and things like that. But like, I've noticed since watching some of your videos, the isometric, like get in the right position and work more isometrically
Yes.
helps a lot more with activation and things like that. And you would, yeah, attest to that as well.
Yes.
Okay.
It's all about getting that proper position, and then people are shaking.
Yeah.
Like I will have like big like cross. I've trained an NFL football player before, and he's like, like
It's really hard and
Yes.
it's really strong, but
Yes.
yeah, it's just
Yes.
something he's not used to.
Okay. See how that feels? Do you need pain right there?
No, I'm paid on the side of my side.
Okay. Off the side of the hip? Okay, so let's see if we can get rid of that.
Okay.
Go on your side, either side. Let's go actually face this way. So that we can see. Okay, go on your left side. Very good.
Whoa.
Yeah, you can. Good. You relax. I'm gonna take so I can swing it back. Very tight here. And let this knee drop. Okay. Can you feel that? What does it feel like, just so they know?
It doesn't feel bad.
Does it feel like this just won't go anywhere?
Yeah.
Yeah. This is literally me like,
Mhm.
okay, good, other side. Okay, bend the knees. Good, I'm gonna take this so I can swing it back. Okay. And you are hypermobile. So, which exercise do I wanna do? Let's go. I know, we're always like, oh, more flexible, better. Okay, go on your back. Put up my table. Lift up your legs for me. Make myself at home here, sorry.
Yes, seriously, like I said, if you need anything else.
I'm gonna bend your knees. Good, I'm gonna widen them. Okay, so what I'm gonna have you do is squeeze my fist. Good. Keep this leg digging. I'm gonna use this fist. Straighten this leg. Yep, squeeze my fist. Good. Okay, hold that and breathe. Can you reach your left arm to this foot? Good, keep your head down. So what I'm doing here, I know it looks very complex. What I'm doing here is we're engaging your hamstring. We're getting your abs. So we're getting your abs to pull her pelvis back from the top down, and her hamstring to pull her pelvis back from the bottom up. So she just needs different things because she doesn't have the hamstring stability, so she needs hamstrings. So that's why I'm starting with that. Good. And put this foot down. Yep. And straighten that one. squeeze my fist, and then this thing is gonna reach. You feel your abs here. You feel here. Good. Squeeze my fist a little. The nice thing is the exercises are kind of confusing, but you only need, I rarely ever give my patients more than 2. Because they do so many things at once that you don't need to do 45 minutes of therapy exercises every day. I mean, who has time for that? I don't. But if you can get efficient things and know exactly what their body needs, you don't need to do a lot. Good. Okay.
You need to use like a tennis ball.
Yes, a tennis ball, a toilet paper roll, a little sweatshirt, it doesn't really matter. Now let's do one more set. Your body's gonna be more stubborn. Dig, let's heel, yep, good squeeze, and then that, yep. So if you're hypermobile, for those of you who would go further than touching your toes, this would be a good one. Or just the first one you did with your feet on when you're on the floor. That's a good one too. Get your hamstrings working? Okay. You can just put your feet up on a couch, a table, a chair. Good, switch. Last one. One here. So quiet. Good, relax. Okay, lift up your legs for me. Roll onto your left side. Let's see. Hypermobile people tend to be a little more stubborn. Get buttons like a drop. Better.
Yeah.
Good. Go ahead. Could you feel the difference?
Mm-hmm.
What are you gonna say? Maybe take a second, swing back. Good. Let the knee drop. There we go. Y'all, that can you guys see this like a drop? So the right one is a little more stubborn, which makes sense. Go ahead and stand up. And then do a lunge. You're gonna see how that feels in the outside of that hip. It might still be sore, but I'm just curious.
Yeah, it's sore, but it's not. It's in a different place.
It moved?
Yeah.
Good, good, very good. Did you feel it more in your butt or on the side of the hip? Okay, a little bit further back. Yeah. Okay, good. Yeah, we need to get your right pelvis a little bit more. But, good, you can sit down. So does that kind of put it all together?
Yep.
That you need, their muscles were holding on, right? Their back muscles, their IT bands is what I think you're feeling at first, like the TFL. That's the muscle of the IT band. But those muscles were like holding on for dear life because the pelvis was tipped forward, and your brain is so powerful. It's like, if I let go, she's gonna fall. Which isn't necessarily the case, but we need to give our body back the stability it needs so that it can let go of the stability it doesn't, or we don't want it to have. Make sense? Okay. So again, 2 people, same symptoms, same aggravating activities, very different exercises, right? Because their body needs different things. So there isn't a one-size-fits-all, which is so hard. I have patients or friends or whoever all the time like, my knee hurts, what should I do? I'm like, I don't know. I need to test it. Like, I have no idea. Because everyone's body tells a different story, right? Everyone's body needs different things. So it's so important to test and retest. So that's like a small picture of what I do with every single patient. And because it's like you have to test them. What is your body telling me today? What does it need? Do an exercise. I need to retest because I don't just assume I know, right? I need to know your body is doing what I want it to, so you're not wasting your time at home. And then every single visit, test, retest. How is your body progressing? What does it need today? Because as you progress, you'll need different things. So like now, your pelvis is almost there. If we did a few more sets, that it would be. Then I don't need to do a repositioning exercise. Now I need to do a stability exercise to keep you there. Make sense? So in summary, there's no one size fits all solution for back pain. For lasting results, we need to find the root cause instead of just treating the symptoms, and we need to understand how the body works as an integrated system, not just isolated parts. You're not going to get anywhere if you do isolated parts, or if you do, it'll be back again tomorrow. Okay, any final questions?
So do they do those same those stretches or exercises you just showed? They do those every day?
I would. So what I do with my patients, so I wouldn't, those exercises aren't gonna fix your pain, right? It'll probably help, but it's not the whole picture. It's, the first step is getting the body in the proper alignment. The second step is teaching your body how to keep it there during functional activities. So I wish I knew this is step 1, 2, 3, 4, 5 for you, but again, everyone's different, right? It's like, okay, this is the first step. I don't know what your body's gonna show me next time.
So if you evaluate
Yeah.
a person, then you will be able to give them a program.
Yes, yes. I know, I wish it was as easy as just like, okay, here are these 5 things to do.
Right.
I would be doing you a disservice if I did that, because then
Well, that
it
makes
would
sense.
Yeah, but it's all about what does your body need now, and then progressing it until it gets to the point. And I have all these tests, because subjective is like how people are feeling. Is obviously the most important goal is get rid of pain, right? But like sometimes I'll have patients like, oh, my pain is so much worse today. Well, what did you do yesterday? Well, I snow shoveled my whole driveway. I'm like, okay, like, you know, I want to get you to the point where you don't have pain with snow shoveling your driveway, but subjective is there are so many factors and variables that influence it, that's why I have so many objective tests. Like that's just one of so many, so that I know exactly where your body is, not just is it inflamed because you shoveled the driveway or raked leaves or whatever. Does that make sense?
Yeah.
Does that
Like
make
for
sense?
me, I have different pains, different places, different days.
Yes, yes,
Right?
yep. So it's the nice thing about
So
this.
it's learning probably by going to you,
Yes.
you would tell me, like, okay, with my shoulders, okay, that this day do this, or my back.
They're
my back,
probably
my-
all connected,
Probably.
all your pain points. So the nice thing about the test is, like I said, that was just the pelvic test, but I would test the whole body. And so I have patients who come in, I usually get the patients who've tried other things and it didn't work, and then they come to me, which I love a challenge, but I'll have patients who have like right shoulder pain, left hip pain, right inside knee pain. And if you think, if their body is like this, their left pelvis is tipped, I'm not gonna talk to you like this. So then I compensate this way. And so then my right shoulder is tipping forward, my left hip is tipped forward, causing left low back compression, and then my right knee is rotating in to compensate. So the nice thing is we can fix everything at the same time, because we're treating the position, not the symptom. Does that make sense?
Yeah.
So it doesn't, for me, it doesn't really matter that your symptoms move around, because I'm treating your body. Does that kind of make sense?
Yeah.
Yeah, good question. I mean, the symptoms matter, because I want you to get rid of them, but
Yeah.
symptoms can be misleading.
Okay, we do glute bridges, they sometimes have us put a sandball between our knees and we have to squeeze it.
Yeah.
I can't do that. I can't squeeze the sandball with my knees.
Because your inner thighs are weak.
I don't know,
Because the inner thighs are very important at stabilizing for the back. And so that one on the back, when you dug your heels down and you squeezed your something between your knees, I would do that one
okay.
to start. Yeah. Yeah, if anyone has questions, you can,
So you're in Holland?
yes, downtown.
Okay.
If you know where JBME is, right above JBME, it's dangerous.
And you take better care of them?
Downtown is dangerous.
Yeah.
So we're out of network. So what that means is full Medicare
Oh, yeah.
is not reimbursed.
I can spend some time in
We
there.
use HSA. We use HSA, but.
Yeah, there you go, that's awesome.
Yeah, but if you have questions, you can call and Pete can walk you through all of it. If you call, he's gonna answer the phone.
Nice, yeah.
So are you a physical therapist too?
No.
Yes, you are.
I'm just married to.
Yeah, that's my husband.
Yeah.
Yes.
I just run the business operations, so I answer
All right.
any questions that you might have. as
Yeah.
far as-
So I can do my job.
So I do have a question.
Yes.
So do you need a referral to get
No.
an appointment with you? We can just call.
Yeah. Yeah, luckily not. Until you're like 21 days or 10 visits, but I just would send a note to your doctor and then they sign off, so you don't have to do anything.
It's very easy. The doctors never look at it.
Oh, they don't even read the notes half the time.
I know.
And if they do,
And
they
if
come
they do
back.
refer you, if they do refer to you, it's like, well, right side of low back pain.
Yes, yeah. They just, it's a logistic that you have to do for Michigan law. Insurance covers? So it depends on your insurance. So we're out of network. So we're covered by out-of-network benefits. So every insurance is different. So some insurances provide good out-of-network benefits. If you have a high deductible, so like I have I think it's 14,000 for a whole family I pay.
Yeah.
Yeah, it's crazy high deductible. And so if you were to go in network, it would be like $350 to $400 a visit, which is insane. But and then compared to outer network, and you don't really know until like 6 weeks later. Like what other field can you say, I will provide a service rate and I'll tell you the price later?
Yeah.
It's like so bizarre to me.
Yeah.
But anyway, don't get me started on health insurance. But
Do you go in without insurance? Can you, what do you do, like straight up charges without insurance?
Yeah. So HSA, you can do no insurance if you want to submit the super bill. It's what it's called to insurance. It's kind of like getting rid of the middleman. So you would just submit the super bill to the insurance, and if you have out-of-network benefits, they would reimburse you. The only company I know for a fact that does not reimburse is Medicare. But
What's that?
I hate Priority Health. Often does.
Yep.
Obviously,
Medicare.
you can't submit to Medicare.
You can submit to priority health.
Yeah.
Yeah.
But yeah, everyone is different.
It's such an individual.
I hate health insurance because the crappy thing with health insurance, because I was in network years ago. If you came in for right knee pain, if I treated something else, your pelvis, they would deny it.
Yeah.
And then you're paying $350 a visit for a 30-minute appointment, and then you're stuck with a bill in the end. So it's like, it's so messed up. They want you to do this, which doesn't fix the problem. But anyway, so to really go full body to get to the root cause and to actually give patients like an hour-long appointment, you just can't be a network, which is unfortunate.
And it is a growing trend for doctors and whatnot to go out and
Because it's the only way you can get good care.
Sure.
That's it, don't get me started. Yeah, good question. Any other questions?
I'd say like anything, like, cause obviously a lot of our, we talk about all the time is like, you're getting these dysfunctions not usually from the 35 minutes of the workout, but it's usually like, hey, what are you doing for the other 23 hours? Are there any, and I know you don't want to get into like, I hate all of this here, but like, if there's any like things like from ways you would say from, I know sleeping is gonna be a big one, how you sit in the chair is gonna be a big one, things like that. Anything that you've seen that could just help all of us just be able to kind of just think of those kind of things throughout our day to day. I know that's kind of a loaded question, so sorry.
No, you're good.
Yeah, right. Yeah.
It's not necessarily, it's more how you're doing the activities that you're doing. And it's not just like fix your posture. So it's how you're walking, it's how you're sitting, it's how you're standing doing the dishes, it is how you're squatting, right? But it's not like your form could look perfect, just like how you were doing that exercise. If I would look at you and be like, that looks great, but your body was choosing the wrong muscles, right? So it's not necessarily like just do sit different.
Sure.
It's why is your body sitting the way that it is. Does that? I know that's not black and white.
Definitely, because you're talking a lot about like how the mind talks to the muscles, the activation piece of it, things like that are really, in your opinion, probably more important than even like how we're kind of sitting there.
100%.
Yeah, totally.
I would say one thing that is super helpful is if you're standing, because I know prolonged standing can be hard on your body, just have your weight in your heels.
Okay.
It's such a small thing, but like, because I don't want people to just tuck, because then you're engaging your abs, which is creating downward pressure. But if you think just shift your weight into your heels, your pelvis kind of naturally tips back, and you start to use your hamstrings a little bit more. So I'd say that's one tip that I think is helpful. People have back pain with squats, I would put like a yoga block between your knees, squeeze the yoga block while you do the squat. That can really help to stabilize a little better.
Is shoe selection important?
If you're like running, yes. I mean, if you're doing like squats and lunges and stuff, I want flatter shoes. I don't want a high arch. I don't love arch supports because it makes you can't get into your glutes very well. Because you want your foot needs to flatten to engage those glutes better. So it'll feel better on your foot temporarily, but actually cause some problems in the long run.
Totally makes sense.
but yeah, with running, yes. But again, all these things aren't gonna fix it. It can slightly reduce it. Does that make sense?
Yeah, totally.
Yeah,
Absolutely.
good question.
Yeah, thank you.
Any other questions? Sorry, I went a little over. Per usual.
So what is your Instagram feed? So we
Yeah,
can follow you?
Kelly Ruther PT.
Kelly, which?
Kelly Ruther. So
Okay.
our business is Ruther Health and Wellness.
Yeah.
That's my last name. And so KELLYRUTHERPT.
Okay.
Yeah, I still am, I don't know how this many people follow me.
That's so cool.
I'm like, it's just me. I don't
That's
know.
awesome. That's really neat.
I was at the hospital after I had my baby and in like a medical gown, I looked just so disheveled. And then one of the nurses comes in, she's like, I follow you. And I'm like, this is so humbling right now.
That's so
I'm like,
cool.
I'm sorry you're seeing me like
Yeah, that's
this.
hilarious.
But yeah, I haven't been out there as much since I just had a baby.
Yeah.
But I have a lot of information on there. Yeah. Any other questions?
How old's your baby?
5 months. Yeah, he's a cutie. My mom's watching him right now.
Nice.
Any other questions? Okay. Well, if you do have any questions, you can shoot us an email, call us, whatever. Let's see.
Thank you
Got
for
brochures?
providing your emails. We'll be giving a summary and just.
Yeah, I'll send over a summary just because it's nice to have it because I just brought so much information. I think it's nice to be able to go back and look at that.
Awesome.
And I always talk about different things, so I don't say it until after because I go off on tangents. Okay, good.